Hello, everybody. It's my pleasure to be here with you. Thank you for choosing us. This is Veronica Portugal. I am based in Mexico. It's 4 a.m. local time. So I am grabbing my coffee to talk about public procurement. And here in this session, we will be talking about how to use this tool to ensure an equitable service delivery to citizens, and also to talk about open data, technology, and how to achieve transparency to access, to equal access to a vaccination process, and also to enhance confidence in the vaccination process. So we have a very diverse panel today. We have speakers from Africa, from Europe, and also from Latin America. And we are bringing together civil society, the private sector, multilateral organizations, and also government under the principles of inclusion, diversity, and gender equality. We know that corruption is a scourge that must be fought. The General Secretary of the United Nations, Antonio Guterres, stated that the corruption that has surged during the pandemic must be fought because it's something that slows down the sustainable development. And well, I am here. It's an honor to share the session with Charlene Midway, whose organization is co-sponsoring the session, Development Gateway. And in the first part of the session, we were talking about experience in Africa on public procurement using technology, using data. And in the second part, we were talking about qualities on public procurement and the design and experiences in Latin America, and also the work of the multilateral organizations such as OECD to build trust in the process and to build partnerships to ensure an equal access to vaccinations and public services to leave no one behind. So since we have a very, very busy agenda today, I will give the floor to Charlene Milwin, my colleague. She's going to be covering the part of Africa. And please feel free to write your questions in the chat box. And we're going to take it at the end for the speakers, in case that you have. Feel free. And please follow the conversation in social media with the hashtag C20 Italy. Well, welcome. And please, Charlene, the floor is yours.
Thank you, Veronica. Good afternoon from Nairobi, Kenya, and good morning for all those who had to wake up as early as Veronica. Excited to be here. As mentioned, my name is Charlene Migwe. We'll be co-facilitating this panel. And we'll start off this discussion from a point of learning. I'm pretty excited to have a local government that has been able to run an open contracting portal and publish procurement data for the past 3 years, and has clear use cases of how publishing data and using procurement data to inform service delivery, to inform prioritization in procurement, and to inform value for money has supported the county. So I think I'll just jump into it. And I really hope that from this session, we can be able to learn from the county and find out what can we grab from their lessons learned in the 3 years of experience in publishing procurement data and the use of the data, and how can this be used as these lessons learned apply into what is most relevant now, the COVID-19 pandemic, and how procurement has become more relevant now in ensuring equitable distribution of PPEs, of vaccine, on any form of needed services and goods to all citizens globally. So I think I'll start. And we're very privileged enough to have His Excellency Professor Kibuda Kibwana, the Governor of Makueni County, that is based in Kenya. And Makueni County has been successful in rolling out open contracting for the past 3 years, publishing data from planning to implementation, monitoring of contracts. His Excellency, the Governor, has been a champion of public participation, and particularly procurement transparency to address corruption, not just in Kenya, in Makueni, but in Kenya in general and also in Africa. So I think I'll open it up to Professor. Thank you for joining us today. We'll start our questions with, based on this extensive experience you have, we all know that one of the benefits of transparency and procurement data is value for money. So where users can analyze data to inform pricing, but more importantly, supplier performance. So in your experience, in your own words, how has open contracted benefited the county in achieving value for money? Over to you, Professor.
Thank you very much, Shalim. And I want to say good afternoon from Kenya to everybody. And I'm really very excited to be in this global meet on open procurement data, open contracting. My name, again, as you said, is Kevuta Kibwana, governor of a subnational government in Kenya. There are about 47 of them, and Makueni County is one of them. And as of now, it is the subnational government that has fully embraced open contracting. There's another one called Elgeyo Marakwet, which is also on the way to doing so. And currently, this idea is being discussed widely within the country after our initial attempts to make it a reality at the subnational level. Actually, as far as Makueni is concerned, we had a very humble beginning in terms of embracing this idea. My son, Christopher, stumbled into the work of EVOS. And EVOS was encouraging entities within our country and on the continent to try open contracting, to embrace it so that it could help cure the problem of corruption, which of course is endemic on the continent and elsewhere. And he encouraged me and my county government, our county government, to approach EVOS. And when we did, EVOS was very receptive, and EVOS introduced us to Development Gateway to assist us in this journey, because for the subnational governments and even the national governments on the continent, you need to be helped, because this is usually a technical area, and it also requires courage for you to adopt it. And so with the help of EVOS and with the help of Development Gateway, we decided to go this route. Of course, we had challenges in terms of when people realized, particularly some of our staff, realized that what the procurement data would be open to the public. Unlike, like something here we call IFMIS, where the data is only open to the government, particularly the national government, not even county governments. So when some of us realized that this was going to make all this information open, some people were trying to hesitate. But we said, because corruption is not official policy as far as we are concerned. I say official policy in quotes. We say that there is nothing that we want to hide. The resources that we have are public resources. They are not personal resources. And the public requires to know exactly what we do in terms of how we spend their money. And so in December, after a lot of work, in December 2019, we now started making our data available, and all the steps that Charlene has discussed. And because I'm here with our Minister for Finance and the Director of Procurement, they will also supply any information that is required. And so we have been doing this now for 3 years, and by June 2021, because that's the end of our financial year, like in some of the key departments, we were able to save on costs For example, Department of Water, we saved 50 million Kenyan shillings, which is the equivalent of 451,548 and 81 cents US dollars. Department of Transport, we were able to save $30 million to date, which is about US $279.29. So because of the competition that now became apparent, because people now had confidence to approach our procurement because they realized that there was, competition, all the information would be available. So it was not easy to be shortchanged and to, spend money in terms of procurement costs, and then you are rigged. So when they realized that there was a lot of transparency, they were forthcoming, and some of the best contractors had confidence to procure for goods and services in our county. And so within that period, we had savings of about 722,478 and 10 cents dollars, and we would plow back that money to do now extra works, and the citizens were now receiving a second budget. And of course, I've just given an example of the two top most departments. There are also other departments where we had savings, but the citizens also like this because, first of all, they saw the information of what is being done, and they saw that there was extra money which was saved, and therefore we would go back to ask them, what do you want us to do with this extra money which has come because of our being careful about procurement. So there was definitely an improvement in value for money, improvement in money now becoming available, which probably earlier was not necessarily the case. And then our workers, particularly in the procurement department, and also the people involved in that procurement chain, of course, now had to be very careful because they knew if you make a mistake, then the mistake is permanent. It's a permanent record, and if it's criminal, then you will have to face music. The evidence will be there. You will have provided your own evidence, so to speak. And so they became more careful. This process assisted them in terms of being very professional, ethical, and as a result, from that period, 2018 to 19, we never had a procurement-related audit query from the National Audit Office. Clients now also became very, very careful about attaching false documents because they knew when you say that you have done work in a particular place, this is evidence, this is permanent record, and you will face the music when this becomes an issue. Somebody raises it as an issue. In 2018-19, our audit reports were very good when we started open contracting, and actually we were one of two counties to receive a clean audit report, something that is very unusual in the situation because even at the national level, departments rarely get clean audit reports. So we saw that as a benefit of open contracting. So for us, this is really a system that should be practiced by the other subnational governments, even at the national level, because when you're dealing with public money, there is no reason to hide how it is being spent. The contractors now understand the process, and they're happy that there is fair competition. And also the citizens, because they have the mobile phones, this low tech, they are able to look to follow the status of projects in their localities. And again, this improves project ownership and sustainability. And we have a system of even them being part of supervising the projects, approving payments and so on. So even now, as Makwene County, we are part of the open government platform, and I think part of the reason of being admitted was evidence on among other areas of open contracting. So that is what I could say regarding how has open contracting helped us improve value for money and the genesis and the interest that we had in embracing it.
Thank you, Governor. That was really useful to also have a background of the journey. I think we've been able to attest that open contracting does take many years to institutionalize, building capacity of staff, building buy-in from staff, and more importantly, you've highlighted really well, how can we make this data more available to communities through low-tech that you mentioned, and people being able to see the implementation of contracts and how that affects them. Thank you for that. So to finalize with that and to bring us also back to our theme of today, we all are facing the COVID-19 pandemic. That's a global issue. And maybe you could speak particularly to what are some of the lessons learned in procurement during the COVID-19 pandemic. I know in Kenya, vaccines are currently centralized within national government, but we know COVID-19 also goes beyond vaccines in terms of PPEs and other ways that local governments can support addressing key challenges with COVID-19 pandemic. So maybe you could highlight that.
Yes. Makwene County was, I think, one of the first counties to publish COVID-19 contracts, because the national government did ask that COVID contracts be published, and because of also doing the contracts through open contracting, they were already available, and so we were able to provide this information, and our contracts were about $1,291,196.38. So again, we didn't have a problem when we were told that this now will be important national information, because already we had it, and it didn't take a long time to make it available, which is one of the good things about open contracting, because the data is real time. One of the problems about COVID-19 procurement was, since it's an emergency, people can very easily take shortcuts and say that we have to do certain things quickly because this is a big pandemic and we need to react. And that is why in our country, we had, a number of scandals relating to, corruption in COVID-19 related procurements of PPEs and the other areas of procurement, until there was a new term in the country of COVID-19 millionaires, because it's people who, would go and they would be told, you want to procure something, and they would be somehow given contracts without due process. But that didn't happen to us, because already we had in place open contracting. But this was a problem, and even up to now, there are investigations ongoing for some of the people in the country who are able to, do contracts in the wrong way, saying that there is an emergency and therefore many things require to be done. And it was clear that, like, some of the PPEs were being bought for very high prices, and eventually you find that it's really something that is very cheap, because initially some people wanted to cash on this pandemic. And of course, for us in Makwene, we also ensured, transparency. That when people, really want to ask, how the procurement is being conducted, who has won the tenders and for how much, so that they could hold us accountable. And so particularly where it seems like an emergency issue and people can hide behind, that, that's where open contracting helps really a lot, because there is already a system. Even if an emergency emerges, There is already a system that is predictable, that is transparent, and citizens will be able to see how their resources are being used. I think that's all I could say in terms of what are some of the lessons learned in procurement during COVID-19 pandemic.
Great. Okay. Thank you, Excellency. I think that has been really great to hear it from an implementer's point of view, to a government that has already taken the necessary steps to start publishing data and start thinking of what procurement transparency will mean to governments moving forward. And I like what you said on once you have systems in place, when we get shocks such as COVID-19 or any other emergencies in future, if you have the right procurement systems and the right transparency structures in place, then we will not have challenges of corruption, because we'll be able to flag such issues through procurement data, and we'll be able to address such issues in future. So I'd like to thank you very much for your time. But before we wrap up the session, I'd like to hand over to Christine Robinson, the head of advocacy and open contracting policy, who will help us in tying in all that His Excellency had mentioned on value for money, on low tech, on how we can use some of this for in the COVID-19 discussion, bring in issues such as vaccines and try to tie it back to what does this really mean, and what lessons from the lessons learned that have been highlighted by the county, what can we borrow from that, and how can we introduce this and integrate all this into the work that we're currently doing.
Thank you so much, Charlene, firstly for inviting me to join today, and thank you to Jean and Julia at the C20 who've done such a wonderful job coordinating all of our activities and inputs, as well as this parts of this summit. I'm the head of advocacy at Open Contracting Partnership. As Charlene has mentioned, we're working in over 30 countries on opening up public procurement and building trust around how citizens' money is spent on contracts with companies. Looking at what we can learn from Professor Kibwana's experience, I think it's really important to take what's happened at the county level, and Makwene County has done some incredible work. So I will share a blog in the chat later about some of the detail of the wonderful work that's happened there, so you can all read even more. I think it's important to zoom out and look at how big the public procurement market is. It's $13 trillion. $1 in every $3 spent by a government is on a contract with a company. It's also government's number one corruption risk, and healthcare procurement in particular is one of the most prosecuted sectors under the OECD anti-bribery convention. So there are two things when we think about that I really want to remind us of. The first is that procurement isn't just about paperwork and process. It's also about people and power. And key to that is building trust. And I think so much of what Professor Kibwana shared with us about Makwene County and the change in the trust amongst citizens once contracts were open and information was public really speaks to that it's not just about process and compliance. It's really about people and in the impact we want to have using citizens' money. The second important point I really want to make here is that open contracting, the process that we've just heard about that was implemented in Makwene County, is that it's not just about data and open data. It's also about communication and culture. And that means open communication and consultation with the market, industry, with community, with civil societies, and trying to promote procurement as an efficient outcomes-based activity rather than a tick box exercise. So those are two things I really want us to remember, that it's about people and power, and it's also about communication and consultation. And I think nowhere has that been more apparent than during the pandemic. We've talked a lot about trust already in this session, and I think the vaccine rollout and procurement is a perfect example of what happens when secrecy takes over and trust diminishes. we've published, I'll share in the chat, a blog about the case for open contracting around the vaccine. And we've also published a guide to vaccine procurement. And that guide doesn't just focus on process and the particulars of medical procurement, which can get quite technical quite quickly because it's a very highly specialized and highly regulated sector, as we all know. It's really looking at what information government should be communicating at what point to build trust. And we all have seen the headlines about vaccine hesitancy. There's also some FAQs in there around confidentiality. I think we hear about trade secrets and confidential information a lot when it comes to medical procurement, and that's happened as well during the COVID-19 pandemic. And there are two things I want to comment on around that. The first being that when public money is being spent, the items that are kept confidential should be done so with regard to what's in the public interest. It's public money. The public has a right to the information that's required to build their trust and to make sure people feel comfortable with how their money is being spent. The second is that while confidentiality and trade secrets are valid, working around them is a very solvable challenge. It shouldn't be a roadblock. We shouldn't see vaccine contracts that are completely redacted and all blacked out. I also think looking at around the world, we've got a lot of speakers here from Latin America or Africa on this call. Some of those countries are receiving vaccines through donations. I think it's also important to remember that procuring something without a cost is still a procurement, and those procurements should still be open as well. I think that there is sometimes a bit of an elephant in the room around the vaccine contract and the vaccine donations being made around, okay, well, we've gotten those for free. We don't need to disclose those agreements. We don't need to share why we've chosen those vaccines, why we've picked those particular vaccine donations. And with the vaccine hesitancy we see around the world, I think it's really important that citizens are reassured that the vaccines they're getting aren't being received and accepted for political reasons or just because it's what the government could get a hold of, but that those decisions have been carefully considered as well. So in summary, I think open contracting has a lot to offer for the healthcare sector. It is a difficult sector because of how much corruption and bribery happens in healthcare and because of how high the stakes are. When procurement goes wrong, people don't get treatment, people get sick, people can die. So it's really important to make sure that we're communicating with citizens through data, but also through stakeholder consultation involving the communities that are going to be impacted by these decisions, and also making sure when we're implementing the contracts that there's a strong feedback loop with patients and hospitals and other medical communities to make sure that what's being bought and what's being procured is actually delivered and effective, and that we're measuring that not just on how cheaply we procure things, but also in terms of public health outcomes. So I'll share some links with some more information, and I hope that's a helpful look into how open contracting can promote transparency, but also build public trust. Thank you.
Great. Thank you so much, Kristen. And just to wrap up, I think it's to say a very big thank you for our two panelists. Professor Kibuda Kibwana, Governor, thank you very much for your time. I think it's always invaluable to have someone in the room from government who's been able to experience it and roll out and share your challenges. So we deeply appreciate that. And we appreciate you, Kristen, for also taking the time to showcase with that. Just to wrap up everything, I think one of the key lessons learned is already have a system in place. And this involves having the right IT systems in place, such as we've seen Makweni do. Make sure that the data is accessible to citizens through mobile data, low tech, or any other form for citizens to be able to be engaged better. But over and above that, engaging citizens to be able to support the decision making to make sure we have the relevant solutions to our citizens' problems. And from Kristen, of course, people and power. Procurement is just not buying of goods and exchange, not just a business, but a lot of people's lives depend on the procurement systems that are in place and what procurement does. So I think I'll wrap that up and hand it over to Veronica. The question and answer question, as Professor Kibuda Kibwana has said, his team, Mary and Alex, will be here at the Q&A session to to give any feedback that they needed. Thank you, and over to you, Veronica.
Okay. Thank you, Charlene, for this part of the session. Very interesting to hear the concept of open contracting, what is, and also to hear the experience from Africa. This session is very focused on the Global South. Yeah, and well, in this side of the session, in this part, it's an honor to share the panel first with Alejandro Sanders, he's from Mexico. He's a consultant in health policy, and also he served in the past as chief of staff of the Minister of Health, and also he served as advisor to the Minister of Finance. And he's currently pursuing a master's degree in the London School of Economics and Health Policy and in the London Hygiene School of Tropical Medicine. First of all, thanks, Alejandro, for accepting the invitation, for being here. We have too many Alexanders here in this panel. It seems that it's a popular name or it's a requirement to be in the session. Well, first, I want to ask you, given your experience in working in the health sector and also in the finance, public finance sector, could you mention a mechanism of public procurement that would have been an alternative to the current public procurement mechanism consisting of direct award purchases? And the other question is that do you think that the current distrust in the vaccination process is a consequence of the secrecy and the lack of mechanism of transparency in the public procurement, and also the perception of corruption in the past? It's important to mention that in Mexico, we had a pandemic I think like 10 years ago with the swine flu. I am old enough to remember I was working in the health sector when that happened. And we had also an experience with public procurement in that moment. So please, Alejandro, take the floor. And
well, thank you so much, Veronica. It is a pleasure and a real honor to be here with you. Thank you for this learning opportunity. And I think we have to disclose that requirement that we have to be Alejandro to be here. Thanks for the opportunity. Just to give some context to the audience, in Mexico, we had in place from 2013 to 2018 a mechanism called the consolidated purchases that was led by the IMSS, which is the main institution that offer national security in Mexico. That I think it worked relatively well, but there was generalized perception of corruption. And because of that, the current administration decided to change the mechanism. And unfortunately, I think the desire to address this problem has led to new ones, because first, the mechanism of procurement was moved to the Ministry of Finance. And I think that the Ministry of Finance is not in the best position to do this because of the know-how and perhaps the incentives to buy medicines and medical devices is not the same for the health sector than the finance sector. But well, at the end, the mechanism was changed to the INSABI, which is a new institution that replaced Seguro Popular. And to be honest, there is not, they haven't been successful enough to publish the rules and the mechanisms of how they are buying. But what we can see, and there's a lot of evidence about this, there's a good review by The Lancet, recent one, that says that there's more lack of medicines and that also an increase in the directly award contracts. So what I want to say here is that perhaps the best way to address wasn't to change everything, but to address some things that could be done better. For instance, there is evidence that there were a lot of corruption, but mainly at the local level and mainly at the distribution stages. So it would be better to have a strategy to address that, and afterwards to identify other ways to change things. But at the end, the generalized perception of corruption led to a more vulnerable system of procurement. A big difference between what is happening today and what happened in that scenario that you mentioned, Veronica, it was that we had in place a national security council, a national securities council that made decisions in a collegiated way, not in just one person scheme as it's happening today. And I think to make it public and to make it with more members making decisions, it is a good way to build trust around the public. Regarding your second question, Veronica, I must say that corruption in Mexico, it is also a pandemic, as important as COVID-19 perhaps, or more, and it has been also a chronic disease. But the pressure of the pandemic and also some political decisions have increased the perception and a loss of confidence and trust around the public perception. So what I think is that we have to work on transparency, accountability, because it has a result, a cause, and a direct impact in decisions at group level, but also at an individual level. I remember well the case in the state of Veracruz, where there was said by the former governor that children was given water instead of chemotherapy substances. And that led families to make a decision to stop the chemotherapies. So that was an outcome that was life or death outcome. In the case of COVID-19, we can see the same phenomena regarding trust and confidence. For instance, in the case of Mexico, it was very misleading, the decision of changing the administrative structure of COFEPRIS, which is our regulator, it's the Mexican FDA, long story short. And they changed this to reduce, at least the perception is that that happened, to reduce the autonomy of this regulator. And in the middle of a pandemic, I think it's not the best idea to reduce autonomy of the regulator, right? Because you have to increase efficacy and efficiency, but not credibility. So that was a decision that I think has been very unfortunate. Just to offer you and to say thanks again, I think this kind of discussion are super relevant, and that we have to tackle corruption with the same stress and with the same importance as we have done with COVID-19. To propose to you some takeaways from the Mexican experience. First of them is anti-corruption is also perhaps the most important public health issue because it has a significant impact on life or death outcomes. Then perception is as important as reality. A more robust system of accountability and communication are urgently needed. And finally, that there is no room for more improvisation. We have to be well prepared for the upcoming pandemics. So let's be prepared. And thanks again, Veronica, for this opportunity.
Okay, thank you, Alejandro, for your insights. Really, the health sector is very special and has a specificity, that make it prone to corruption. Working there, you realize that you need like specialists, like technicians in that area. So very relevant what you have mentioned. And then I would like to give the floor to the other Alejandro Baron. He is from Spain. He's currently pursuing a PhD in the Johns Hopkins University. He's very focused on public procurement policies in Latin America. And well, the first question I want to ask to Alejandro Baron is first, after listening to the experience of Africa and with your experience in the researching on public procurement policies in Latin America, what lessons can the global North learn from the global South? And the other question is that what kind of designs in the mechanism of public procurement will be needed to develop the trust in confidence in the vaccination process. We have seen like a lot of doubts from the people, and it's very related to what Alejandro Sanders mentioned at the end. So please, Alejandro, take the floor.
Thank you, Veronica. Thank you for giving me the floor. And just a little bit to take on to what my predecessor, the other Alejandro, was saying. So I would lay out 3 general principles that the global North could learn from the global South, even if there's many cases in both large regions. The first would be, so take, for example, a country like Paraguay. Paraguay, which probably from the start doesn't have the state capacity in technological terms that some countries in the North, in the global North could have, has done a very good work in publicitizing contracts and putting all COVID-related contracts and expenses online and absolutely publicly for citizens to view them. Other countries, such as my own country, have had problems in posting contracts in time, and this can create sometimes a little bit of uncertainty as to what is being bought or not from the procurement point of view. So I mean, the first idea would be that transparenting has to be done in time, and this goes to what His Excellency mentioned at the beginning of this session. And the second would be deterrence through cooperation of state authorities. Then I would like to bring Colombia. Colombia is a great example of how the state attorney, the ombudsman, and the interventor general of the country reached an agreement, struck an agreement at the very beginning of the pandemic, and they were able to deter corruption and also to catch a lot of cases in early stages, especially at the local level. Which probably, if each one of these institutions had tried to do it solely or by themselves, they would have had a harder time. So again, cooperation between state authorities, especially control authorities, is very important. And then the third principle, just to be very short, would probably be to try to prevent and not react. So the Russian public procurement in the pandemic is being unprecedented. And there are several tools and instruments at play for governments, both in a more automated and non-automated way to monitor. So here, the watch effect to be able to prevent before it happens is really useful, because that's where you're saving the money. That's where you're really, creating the margin for that value for money that we were speaking before. So first, obviously try to use technology, and that will come back to that earlier when I answer the second question. Big data, many things have been said about big data, but if in countries where there's weight, big data techniques should be applied. Big data is not, let's say, a universal solution, but it can help. Then also adequate management about info, about procurement, including red flags, conflicts of interest, customs information, alerts about unusual amounts, several countries are already setting those kind of red flags in their procurement systems. So when you buy something, or when someone buys something on the behalf of a public procurement system and it's unusual, having that red flag before finalizing the purchase is a useful tool to try to mitigate before it happens. And then there have been some discussions in some countries about changing in very in this specific point of time the way in how you do purchases. So, for example, if a country has a very centralized supervision, why not centralizing purchases for a while, or just COVID purchases? And on the other way, countries with high decentralization, if the legal frameworks allows for it, could be conducting exceptionally also public purchases in a more decentralized manner to try to adapt this idea that that monitoring has to be adapted to the scale of the purchase and the territory of the purchase where it's being done. And then the second question, which also needs a very applicable answer and a very on the ground answer. What characteristics should a public procurement method have for Latin American region, for example? So then you have mainly to bundle confidence and efficiency. These are the two things, and there's not really a secret, but there's probably some things that you can do. Some of them have been already discussed by Alejandro Sanders. First of all, on the side of citizens, you have to let them know that tendering processes are competitive and open, and that has to be guaranteed at all times. There is no favoritism. One thing that you can do, and going back to what His Excellency talked about, is this idea of third-party certification. Third-party certification can help you to bring this element of ensuring that citizens trust in public procurement systems. So, OGP certification, and also a discussion with civil society groups that then can act as intermediators between what the government is doing and what citizens know is crucial. Then precise information on each vaccine lot. That's very important. There has to be information on X vaccine lot is being delivered at X place and it's being inoculated with technologies. There are easy, cheap, and off-the-shelf solutions with open tracking systems that can help you to do that. And this, in turn, can help you to generate very useful data for your own government and also for civil society organizations. And then going to the data, one thing that is very important, and it has been rightly done by a number of countries, including my own countries, this idea that you have to cross data about procured vaccines, so what you buy, inoculated vaccines, what you're able to inoculate, and then hospitalizations and disease rates per territory. This is crucial also to generate trust, one thing that you mentioned in your questions, in those populations that are historically mistrustful of health solutions for a good number of reasons in countries of Latin America nominally. And it could help to generate snowballing effects. Then another thing that you can do is, and this goes to the thrust of our conversation, is building alliances with CSOs. And Christian talked about it, like just you should have in mind that Gavi, the Global Vaccine Alliance, has involved civil society organizations in global immunization efforts for decades. And nowadays, there are more than 4,000 organizations participating in worldwide in vaccination campaigns. So, building plans with a multi-stakeholder view is very important. And they can also help you to strengthen health systems and to get to the citizen in a very finalistic way. I just would like to close with something that His Excellency said, and let's not fool ourselves. Trust and efficiency take time to build in public procurement systems and in states. And if you have a problem of mistrust toward vaccination in a country, one thing that is really going to help is trying to do other things right. So horizontal diagonal trust building is also very important. If you're able to manage your COVID efforts, your hospitalizations in a good way, if you're able to manage your communication policies, this is going to help to build trust beyond what you do in transparency, accountability, and participation, because TAP in the end is just a part of more general policies. So yeah, this is what I had to say.
Okay.
Thank you, bro.
Yeah, thank you, Alejandro, for your insights. Very concise, very complete. And quickly, we have time for our last speaker, who is Annie Norfolk from OECD. She's from the UK. She used to work in the South Asia division, no longer anymore, but she has a lot of experience in that. And Annie, I would like to ask you, we need multilateralism more than ever because of this crisis. And in that sense, I would like to ask you how OECD is working towards building that trust and building partnerships to tackle COVID-19 and also the crisis and the risk of during the pandemic.
Yes,
so Annie, please, the floor is yours.
Thank you, Veronica, and to the other speakers here today. Yes, again, just for time purposes, I'll be very short, but as Veronica rightly identified, multilateralism is the time that we really need, I think that we really need in a crisis, because it's a great way to crowdsource ideas, to collaborate, to share data, to try and make sense of what's going on. The OECD is particularly well known for providing data and for our convening power. So in the early months of the crisis, the OECD focused a lot on supporting governments to strengthen their emergency procurement systems, particularly to address risks of corruption. But as the initial procurement crisis eased, governments in many countries began to really consolidate their procurement efforts, issue additional guidance, strengthen risk management systems, and digitize a lot of processes. And so we kind of, as an organization, we focused a little bit less on that side. And we began to look at other aspects of the crisis and of the vaccine rollout specifically. So the sort of main areas that the OECD is focusing on now when it comes to the vaccine rollout is that we're looking at how we can build trust in our populations, which comes back to a lot of the issues that we've discussed today, to make them confident that vaccines are safe and that public procurement processes are being handled efficiently, to bolster supply and distribution, to anticipate bottlenecks, to provide more support for vaccine delivery and logistics support, to improve access, so to prioritize programs targeting new variants and increase supply to low and middle income countries, to monitor variants and to support safe travel. And also we've been doing a lot of work in the area of trust, which has been mentioned quite a lot today, at looking at ways that we can help to promote the release of timely information data regarding vaccination strategies, and making sure that's in user-friendly and open source formats. And as the previous speaker mentioned, it's not sufficient to just sort of ensure that we're providing a lot of data, but also finding ways to report that data to the public in a way that's very easy for them to understand, and is kind of concise. And also developing public engagement and communication strategies. So we've also seen recently a lot of countries coming up with really innovative ways to target specific segments of the population that might have concerns about vaccines or may not be following public safety guidelines and so on. So with that, I will pass it back to Veronica.
Okay, thank you, Annie, for your insights. I think, well, we have covered all the speakers, and we have 9 minutes more, in case that you want to add something and you want to mention something, and also to give the floor to Jean in case that she wants to ask something, and also to take some questions for the audience in case that there are. And also, Celine, if you would like to ask something to my speakers, feel free to do it. You have permission to do it. And thank you, Annie, all of you, both Alejandros. Please, Jean, in case that you have something to add. Jean is from the Accountability Lab. She's the coordinator of the anti-corruption working group of C20. So, Jean, something you would like to ask to the panelists?
Yes, so we have 2 questions, and let's see if we can get through both of them. The first question is, and I think this can go to anyone in the panel, are there any steps that you are taking to ensure sustainability of open contracting in your country?
Anybody who wants to answer? Raise your hand.
or any, I think what the question was meant to be is, are there any steps that people can take, like sort of individuals can take to ensure sustainability of open contracting? If I read the question.
I can try to tackle that one, not from a country specific point of view. There's two ways to answer that question, whether we're talking about open contracting itself being sustainable in terms of, environmental sustainability and green procurement and supporting those goals the other way of answering that question is to make sure that open contracting lasts and has a community around it. For the first one around green procurement and the sustainability of open contracting, absolutely, that's something we're looking at OSCP, and I know others are as well. It's an evolving and a new area. There's a lot to consider. And I think it comes down to communication impact and being really goal-oriented in what you want from your procurement, whether that's reducing carbon footprint or reducing plastic and so on and so forth. If we're talking about supporting the community and making sure that reforms last, I think what we've seen is that a strong civil society partnership with government is absolutely key. We did some research on 13 countries that had IMF commitments in their rapid credit facility on open contracting. And it was very clear that where there was a partnership with civil society, helping government monitor red flags, consulting government on what the outcomes of procurement should be. For example, in Moldova, looking at how hepatitis patients could be involved in the procurement of medicines for their own conditions, made a huge difference and made the whole feedback loop a lot more sustainable. So hopefully that helps.
That's great. Thank you, Kristen. And Alejandro, you have your hand up.
Thank you, Jana. It is a very high-level answer, but I just want to say, get involved and get informed. Never underestimate the power of citizens that want to make changes. And if trust and confidence is always an equilibrium that requires building a culture, and that requires of all of us, not only the decision makers, to be there. So, short answer: get involved.
I think that's a really great response. And then lastly, are there any concrete examples of how civil society has used procurement data to bring their voices to the table? Yes, Alejandro Barón.
Yes. I would like to mention the case of my own country, Spain, among others. But when the public procurement systems opened a little bit later than the last state of emergency went down, and several civil society organizations actually took that data, the power of that data, which is probably around 30 to 35,000 contracts, and did a series of articles, of blog posts, of research that were widely discussed and both in social media and also policy circles. Now that the question about that is, how can that be also trickled down into control authorities? Because most times control authorities take a lot of time to process that data, and civil society organizations have tech tools that are way faster than what control authorities can do. So that would be my takeaway. Yes, civil society is important to bring into the public forum, but then what do control authorities make out of that?
Sorry, Jean, to butt in. The county just sent me a message. They were trying to answer the first one, but they couldn't unmute. So about the sustainability.
Yes.
If I could just take you back. Maybe Alex, Mary, if you try unmute about this, because I know this is something that's alive in Kenya right now. We have elections that are coming up next year, and we will have changes in regime coming soon. And the county wanted to speak about that.
That would be great. Thank you.
Thank you, Charlene. About sustainability, as a account, we have developed a policy that is in draft form and almost being finalized. And this policy will ensure that we have an open contracting policy and a bill that will ensure that open contracting will go beyond the election year, that is open successive governments. In the policy, we have outlined the roles of the county government executive and the key stakeholders who will be running the open contracting even after the current government is out of office and the new government comes in. And therefore, this is part of the measures that will ensure that whatever we have done and whatever we have developed will go beyond to in the future. Thank you.
Thank you very much for your very concise answer. But I think that was a great intervention. If there are no other points that anyone would like to make, I would like to thank everyone for this really interesting conversation, and really encourage anyone and everyone to please come and join the C20 Anti-Corruption Working Group for next year, which will be hosted by the Indonesians. The more civil society, the more organizations that get involved, the interventions are that we can make to the G20, and the better that the sort of more voices that we can bring to the table. We are this year, we're over 100 organizations from about 83 different countries, and next year we're hoping to have way more. Thank you, Veronica and Charlene. If there are any last minutes that you want to say something, or last words.
I guess I could say then hand it over to Veronica. Thank you all for coming today. I think it's been an interesting discussion on tying in what experiences we've all had from the different countries that we are. I think it's exciting to see a diverse group of speakers from different countries and different regions. And I look forward to continuous discussions on procurement and learning more. And I think COVID-19 does give us an opportunity to put procurement to the test, to see how far we can push the use of procurement as a tool and transparency in providing services and direct needs to all citizens. So thank you, and over to you, Veronica.
Thanks, Charlene.
Thank you, Charlene. It was an honor to share the panel with you and to learn from the African experience, and also to have a great panel with the speakers, with Alejandro Balón, who is repeating. He joined us in the last year in the C20 Saudi Arabia, talking about corruption in the pandemic. And also Annie Norfolk, she's repeating as well, from OECD. She took part in the C20 Saudi Arabia, talking about corruption in the pandemic, how to face it. And Alejandro Sanders, who is new in this process, thank you very much for being part of this. He is the expert on health policy. And she's from Mexico, my country. There is a bias here that two Mexicans, but it's normal. I was the organizer. It was like kind of a bias. So thank you all. Thank you, Jean, for sharing the table with you. It was a pleasure to meet you. And also for all the support that you had with us during the organization of the summit and the panel. And thank you for the experience. And also, Kristen, it's an honor to share the panel with you to learn more about this interesting topic about open contracting, and also to see what you are doing in all the countries, 30 countries that you are working in. And I feel very grateful today, and we learned a lot of things.
Thanks all. Have a good day.
Thank you.
Have a good day.
Bye.
See you later.
Thank you
Bye.
very much.